Hey Alpha, this is Licensure from AlphaNessGuy.com. This is 15 practice questions. With out of the way, let's get started.
The nurse receives a call from the parent of a 10-month-old who has vomited 3 times in the past 8 hours. The parent describes the baby as playful and wanting to drink. The parent asks the nurse what to give the child. Select the nurse's best response. 1. Replace the next feeding with regular water and see if that is better tolerated. 2. Do not allow your baby to eat any solids. Give half the normal formula feeding and see if that is better tolerated. 3. Do not let your baby eat or drink anything for 24 hours to give the stomach a chance to rest. 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. The correct answer is 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. Offering small amounts of clear liquids is usually well tolerated. If the child vomits, make them NPO for an hour to allow the stomach to rest and then restart fluids. The child in this scenario is described as playful and therefore does not appear to be at risk for dehydration. Free water should not be given because it does not contain any electrolytes and can lead to critical electrolyte imbalances. Formula should be avoided, and clear liquids such as Pedialyte should be offered. 24 hours is too long for the infant to remain NPO. The infant needs to drink a rehydration solution, such as Pedialyte, in order to avoid severe dehydration. You should eliminate answers 1 and 3 because they could cause harm to the infant. The nurse is caring for a 3-month-old being evaluated for possible Hirschsprung disease. His parents call the nurse and show her his diaper containing a large amount of mucus and bloody diarrhea. The nurse notes that the infant is irritable and his abdomen appears very distended. Which should be the nurse's next action? 1. Reassure the parents that this is an expected finding and not uncommon. 2. Call a code for a potential cardiac arrest and stay with the infant. 3. Immediately obtain all vital signs with a quick head-to-toe assessment. 4. Obtain a stool sample for occult blood. The correct answer is 3. Immediately obtain all vital signs with a quick head-to-toe assessment. All vital signs need to be evaluated because the child with enterocolitis can quickly progress to a state of shock. A quick head-to-toe assessment will allow the nurse to evaluate the child's circulatory system. All cases of bloody diarrhea need to be evaluated because this may be a sign of enterocolitis, which is a potentially fatal complication of Hirschsprung disease. For option 2, although this is a potentially critical complication, calling a code is not necessary at this time because the infant is irritable and not unconscious. It is not a priority to test the stool for occult blood because there is obvious blood in the sample. You should select answer 3 because there is not enough information to determine the status of the child. Obtaining vital signs will help the nurse to assess the situation. The parent of a newborn asks, "Will my baby spit out the formula if it is too hot or too cold?" Which is the nurse's best response? 1. Babies have a tendency to reject hot fluids, but not cold fluids, which could result in abdominal discomfort. 2. Babies have a tendency to reject cold fluids, but not hot fluids, which could result in esophageal burns. 3. Your baby would most likely spit out formula that was too hot, but your baby could swallow some of it, which could result in a burn. 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. The correct answer is 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. Swallowing is a reflex in neonates. Infants younger than 6 weeks cannot voluntarily control swallowing. The infant is not capable of selectively rejecting fluid because swallowing is a reflex until 6 weeks. You should eliminate answers 1, 2, and 3 because they suggest that the infant is capable of selectively rejecting fluids. The nurse is caring for an infant newly diagnosed with Hirschsprung disease. What does the nurse understand about this infant's condition? Select all that apply. 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension. 2. There is excessive peristalsis throughout the intestine, resulting in abdominal distension. 3. There is a small bowel obstruction, leading to ribbon-like stools. 4. There is inflammation throughout the large intestine, leading to accumulation of intestinal contents and abdominal distension. 5. There is an accumulation of bowel contents, leading to non-passage of stools. The correct answers are 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension, and 5. There is an accumulation of bowel contents, leading to non-passage of stools. In Hirschsprung disease, a portion of the large intestine has an area lacking in ganglion cells. This results in a lack of peristalsis, as well as an accumulation of bowel contents and abdominal distension. There is accumulation of stool above the aganglionic bowel, which does not allow stool to pass through. There is a lack of peristalsis at the aganglionic section of the bowel. Hirschsprung disease does not include a small bowel obstruction. Hirschsprung disease does not present with inflammation throughout the large intestine. The mother of a newborn asks the nurse why the infant has to nurse so frequently. Which is the best response? 1. Formula tends to be more calorically dense, and formula-fed babies require fewer feedings than breastfed babies. 2. The newborn stomach capacity is small, and peristalsis is slow. 3. The newborn stomach capacity is small, and peristalsis is more rapid than in older children. 4. Breastfed babies tend to take longer to complete a feeding than formula-fed babies. The correct answer is 3. The newborn stomach capacity is small, and peristalsis is more rapid than in older children. The small stomach capacity and rapid movement of fluid through the digestive system account for the need for small, frequent feedings. The caloric content of breast milk and formula tends to be similar. Peristalsis in infants is greater than in older children. Breastfed babies and formula-fed babies do not necessarily have a difference in feeding time. You should eliminate answers 1 and 4 because they both form generalizations that are not supported by current literature. The nurse is caring for an infant diagnosed with Hirschsprung disease. The mother states she is pregnant with a boy and wants to know if her new baby will likely have the disorder. Which is the nurse's best response? 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. 2. There is no evidence to support a genetic link, so it is very unlikely the baby will also have it. 3. It is rarely seen in boys, so it is not likely your new baby will have Hirschsprung disease. 4. Hirschsprung disease is seen only in girls, so your new baby will not be at risk. The correct answer is 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. There is a genetic component to Hirschsprung disease, so any future siblings are also at risk. Hirschsprung disease is seen in both males and females, but is more common in males. You can eliminate answers 3 and 4 because they are similar and therefore would not likely be the correct answer. A 4-month-old has had vomiting and diarrhea for 24 hours. The infant is fussy, and the anterior fontanelle is sunken. The nurse notes the infant does not produce tears when crying. Which task will help confirm the diagnosis of dehydration? 1. Urinalysis obtained by bagged specimen. 2. Urinalysis obtained by sterile catheterization. 3. Analysis of serum electrolytes. 4. Analysis of cerebrospinal fluid. The correct answer is 3. Analysis of serum electrolytes. The analysis of serum electrolytes offers the most information and assists with the diagnosis of dehydration. The information obtained from a urinalysis of an infant is not as helpful as serum electrolytes. The infant has limited ability to concentrate urine, so the specific gravity is not usually affected. A urinalysis does not need to be obtained by catheterization. Although critical in diagnosing meningitis, a lumbar puncture and analysis of cerebrospinal fluid are not done to confirm dehydration. Infants have limited ability to concentrate urine, so answers 1 and 2 can be eliminated immediately. The parent of a 5-year-old states that the child has been having diarrhea for 24 hours, vomited twice 2 hours ago, and now claims to be thirsty. The parent asks what to offer the child because the child is refusing Pedialyte. Which is the nurse's most appropriate response? 1. You can offer clear diet soda such as Sprite and ginger ale. 2. Pedialyte is really the best thing for your child, who, if thirsty enough, will eventually drink it. 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. 4. It really does not matter what your child drinks as long as it is kept down. Try offering small amounts of fluids in medicine cups. The correct answer is 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. Pedialyte is the first choice, as recommended by the American Academy of Pediatrics. Offering the child appropriate choices may allow the child to feel empowered and less likely to refuse the Pedialyte. Small, frequent amounts are usually better tolerated. When Pedialyte is not tolerated, it is usually recommended that clear sodas and juices be diluted. Diet beverages are not recommended because the sugar is needed to help the sodium be reabsorbed. Pedialyte is the best choice. If the child is not encouraged to drink Pedialyte, the child may become severely dehydrated. Other ways to encourage oral rehydration need to be considered. Offering small amounts of liquids is important. The type of beverage does matter because many fluids may increase vomiting and diarrhea. You should eliminate answer 2 because it offers an ultimatum to a child. The child is likely to refuse the Pedialyte, worsening the state of dehydration. Which instructions for a child diagnosed with encopresis should the nurse question? Select all that apply. 1. Limit the intake of milk. 2. Offer a diet high in protein. 3. Obtain a complete dietary log. 4. Follow up with a child psychologist. 5. After dinner, have the child sit on the toilet for 10 minutes. The correct answers are 2. Offer a diet high in protein, and 4. Follow up with a child psychologist. A diet high in protein will cause more constipation. The child and family would not be encouraged initially to seek counseling unless a psychological component to the encopresis had been identified. Dairy products are limited because they can lead to constipation. A complete dietary log should be kept to correlate the foods that lead to constipation. Children with constipation/encopresis are advised to sit on the toilet for 10 minutes after dinner to take advantage of the gastrocolic reflex. A 4-month-old is brought to the emergency department with severe dehydration. The heart rate is 198 and her blood pressure is 68/38. The infant's anterior fontanelle is sunken. The nurse notes that the infant does not cry when the intravenous line is inserted. The child's parents state that she has not held anything down in 18 hours. The nurse obtains a fingerstick blood sugar of 94. Which would the nurse expect to do immediately? 1. Administer a bolus of normal saline. 2. Administer a bolus of D10W. 3. Administer a bolus of normal saline with 5% dextrose added to the solution. 4. Offer the child an oral rehydrating solution, such as Pedialyte. The correct answer is 1. Administer a bolus of normal saline. Dehydration is corrected with the administration of an isotonic solution, such as normal saline or lactated ringer solution. Solutions containing dextrose should never be administered in bolus form because they may result in cerebral edema. Severe dehydration is not usually corrected with oral solutions. Children with altered levels of consciousness should be kept NPO. You should immediately eliminate answers 2 and 3 because they both suggest administering glucose in bolus form, which is always contraindicated in pediatric clients. Answer 4 should be eliminated because the infant is severely dehydrated and not responding to painful stimulation, which is suggested by the lack of a cry on intravenous insertion. A child is diagnosed with chronic constipation that has been unresponsive to dietary and activity changes. Which pharmacological measure is most appropriate? 1. Natural supplements and herbs. 2. Stimulant laxative. 3. Osmotic agent. 4. Pharmacological measures are not used in pediatric constipation. The correct answer is 3. Osmotic agent. A stool softener is the drug of choice because it will lead to easier evacuation. Natural supplements and herbs are not recommended because the safety and efficacy are not standardized. A stimulant laxative is not the drug of choice because it may increase abdominal discomfort and may lead to dependency. Although diet and activity modification are tried first, medications are sometimes needed. You should eliminate answer 4 because it implies that medications are never given to the constipated child. In healthcare, there are very few cases of never and always. Which child can be discharged without further evaluation? 1. A 2-year-old who has had 24 hours of watery diarrhea that has changed to bloody diarrhea in the past 12 hours. 2. A 3-year-old who had a relapse of one diarrhea episode after restarting a normal diet. 3. A 6-year-old who has been having vomiting and diarrhea for 2 days and has decreased urine output. 4. A 10-year-old who has just returned from a scout camping trip and has had several episodes of diarrhea. The correct answer is 2. A 3-year-old who had a relapse of one diarrhea episode after restarting a normal diet. It is common for children to have a relapse of diarrhea after resuming a regular diet. Diarrhea containing blood needs further evaluation to determine the source of the blood, and the child's blood counts and electrolyte balance need to be tested. Children who have had vomiting and diarrhea for more than 2 days require evaluation to determine whether IV rehydration and hospital admission are necessary. Diarrhea following a camping trip needs further evaluation because it may be caused by bacteria or parasites. You should eliminate answers 1 and 3 because they describe children who may have altered electrolytes and blood counts due to prolonged diarrhea. The nurse is caring for a 2-year-old child who was admitted to the pediatric unit for moderate dehydration due to vomiting and diarrhea. The child is restless with periods of irritability. The child is afebrile with a heart rate of 148 and a blood pressure of 90/42. Baseline laboratory tests reveal the following: sodium 152, chloride 119, and glucose 115. The parents state that the child has not urinated in 12 hours. After establishing a saline lock, the nurse reviews the physician's orders. Which order should the nurse question? 1. Administer a saline bolus of 10 milliliters per kilogram, which may be repeated if the child does not urinate. 2. Recheck serum electrolytes in 12 hours. 3. After the saline bolus, begin maintenance fluids of D5/1/4 normal saline with 10 milliequivalents potassium chloride per liter. 4. Give clear liquid diet as tolerated. The correct answer is 3. After the saline bolus, begin maintenance fluids of D5/1/4 normal saline with 10 milliequivalents potassium chloride per liter. Potassium is contraindicated because the child has not yet urinated. Potassium is not added to the maintenance fluid until kidney function has been verified. The child with dehydration secondary to vomiting and diarrhea is placed on a clear liquid diet. Fluid boluses of normal saline are administered according to the child's body weight. It is not unusual to have to repeat the bolus multiple times in order to see an improvement in the child's condition. It is important to monitor serum electrolytes frequently in the dehydrated child. The parents of a 4-year-old ask the nurse how to manage their child's constipation. Select the nurse's best response. 1. Add 2 ounces of apple or pear juice to the child's diet. 2. Be sure your child eats a lot of fresh fruit such as apples and bananas. 3. Encourage your child to drink more fluids. 4. Decrease bulky foods such as whole grain breads and brown rice. The correct answer is 3. Encourage your child to drink more fluids. Increasing fluid consumption helps to decrease the hardness of the stool. Whole grain bread and brown rice are high in fiber and help decrease constipation. 2 ounces of apple juice is most likely not a sufficient quantity to alter a 4-year-old child's bowel movements. Although fresh fruits help decrease constipation, option 3 is the better answer choice than option 2. Answer 1 decreases constipation in an infant, but not in a preschooler. The nurse is caring for a 9-month-old with diarrhea secondary to rotavirus. The child has not vomited and is mildly dehydrated, which is likely to be included in the discharge teaching. 1. Administer loperamide as needed. 2. Administer bismuth subsalicylate as needed. 3. Continue breastfeeding per routine. 4. The infant may return to day care 24 hours after antibiotics have been started. The correct answer is 3. Continue breastfeeding per routine. Breastfeeding is usually well tolerated and helps prevent death of intestinal villi and malabsorption. Antibiotics are not effective in viruses. Children should not return to daycare while they are still having diarrhea. Loperamide slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. Bismuth subsalicylate slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. You can eliminate answer 4 because antibiotics are not effective with viruses such as rotavirus. Answers 1 and 2 can be eliminated because antidiarrheal agents are not recommended in the pediatric population.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.